So I'm Erin. I'm a psychologist in Indiana, and I work in private practice. And as part of my private practice, I also work with a lot of healthcare providers and contract with a local hospital. And the coaching program that I developed is for healthcare professionals, and I help them learn how to use expressive writing as a way to release the negative effects of stress and all of the landmines that are in the healthcare system prior to the pandemic and now as a result of the pandemic, and how to cope with those stressors and cultivate growth both at work and outside of work. So that's my coaching program.
Awesome. Awesome. Well, I can't think of a better time to be doing something like this than, in the wake of COVID and all the healthcare burnout that's happening. And so you definitely picked the right niche. What made you decide to sign with me? I mean, other than the decision to sign with me, but what made you to have the desire to do a program like this?
I think, as part of my coaching program, there was a lot of burnout and a lot of having to do one-to-one patient care hour after hour, and just packing days full of that. And I was burning out and I was really tired. And as part of my own personal philosophy, I always want to spread as much light as possible and throughout my reach. And this program, and when you and I first started talking, that was the first thing I thought, is I could expand my reach.
Makes total sense. I mean, the problem for most mental health professionals is the burnout, but then it's hard to do what you wanted to do when you got into the industry in the first place, because you're income limited, because you're stuck with the income from seeing people one at a time, and your impact limited to the number of people that you can see in your office, and after, a good 10 years or 10 years plus of therapy, then it does start to really take its toll, and I'm not saying that people can't have successful careers in therapy. They absolutely can. It just gets harder as time goes by, especially in the current environment. I don't think that mental health professionals are going to get any less busy than they are right now. I think this is just the beginning. The stigma's been lifted, and now it's time for a lot of people to start doing the work. So
Absolutely.
Tell me, I mean, you had a bit of a journey coming into the program, picking the right niche and these kinds of things, going through the decision process. What was that like for you?
Well, it was a journey. So trying to figure out that was probably the hardest part. And I always knew I wanted to do something with writing and expressive writing, because it's easily coachable and sustainable for people. And I started wanting to help women writers develop a sustainable writing practice. And then that kind of got a little shaky, and I decided to try something that was more aligned with some of the work that I do at a local cancer center, and do writing program with widows. And that started to take off, and it was doing really well. And it just was really aligning with all the clinical work that I do. And I started to feel drained by that. So you were really supportive of a switch, even though, it was probably going to be a very successful program. And I kind of did a bit of a rebrand on that same program, and was doing it then specifically for women writers that wanted to change careers. And that one didn't work out, and that happens sometimes, but kind of just sticking with it and trying to figure out what worked and what didn't work was a coachable moment for me, and persisting and learning along the way, and not thinking all those things are mistakes, but just points of education.
Exactly. Mm-hmm. Yeah. It's all about taking the feedback from the market. And so then you arrived on this new idea. How did that come about?
So the new idea came about in just paying attention to what writers were doing in the market, and what other kind of writing coaches were doing. And there was an opportunity, and already being in healthcare and working in a healthcare system, there was an opportunity to say, okay, let's take this exact same program and work with it just a little bit and tailor it directly to healthcare providers who are struggling and don't have time, or they're too tired to go to therapy, and therapy isn't always the answer. So I took this outline and coaching program and said, you know what, let's start with this. Let's start a new coaching program. And then at the end of the year, I was like, wait a minute. Why don't I try to go talk to the hospital that I already contract with, and see what they think of it? And because I was already up there in the ICU anyway, supporting the staff. So let's just see if this is something that they'd be interested in and providing to everyone, not just ICU staff. And they jumped at it. So that ended up resulting in a contract that was almost very close to a 6-figure contract for a year to implement the service. So
how much time is that going to take you, do you think, to implement?
So in total, for like my workload a week, it's probably going to take about 12 to 14 hours.
Awesome. That's less than 2 days, which gives you a lot of capacity to be adding more contracts of the same size. You are now the highest paid writing coach I've ever met. And I spent 5 years helping to build a company that helped authors get their themselves started. So, that's really saying something. And that's fantastic. I mean, what really happened was you found the right offer at the right time. And that's really what closed it right there. And then you went for the low-hanging fruit right there, which got you your first deal. And I believe it's the first of many. So we're really happy for you. So
thank you.
Amazing return on investment that you're getting.
Absolutely.
But it's not just about the return on investment, because now what you're able to do is combine your healing work, your healing gifts, your healing talents, your experience, your knowledge with the writing that you're so passionate about and that you love so much.
Yeah. And it frees up my time to do more of what I want, which is writing, right? Like, so writing my own book. So I have effectively, been able to step away more from that, hour by hour stuff at my private practice office. And I have another writing day a week now. So
beautiful. Very good. So, straight from, it took a little bit of experimentation. And the interesting journey with you was the fact that we did have a couple of program concepts that were showing those early signs of success, but it was also about finding the personal match for you. Because that's super important, because I do believe that you have to love what you do if you're going to do any kind of coaching, training, or consulting. It has to be in a niche that you really like. It's not just so that you do less of something you don't like, but it has to be about creating something that you love. And so I'm really happy to have been on this journey with you. Anything else you want to add? I mean, I think it's the results speak for themselves, a nearly 6-figure contract, less than 2 days a week, freeing up the time to do what you love and putting your career in doing what you love, making your whole career direction about that. Anything else you want to add so far? Or
I mean, yeah, the quantitative numerical results speak for themselves, I think, too, just for my own well-being. It has done a world of good. And then it has been really such a pleasure and honor to work with you and have your support along the way. And, having obviously the knowledge, for goodness sake, but also just the patience and persistence, and also kind of not taking just strictly business approach, being like, okay, like this is what this person needs and this is what this person needs. And then how we all kind of learn together. It's just such an amazing experience. And I'm so grateful for you and everybody that I met in the program too.
Awesome. What would you say to the person who is considering this, who's on the fence, a mental health professional deciding, I don't know if I can do this, or what's it going to be like, or should I take the risk, or anything like that? What would you say to them?
Yes. So I would say that anything new or outside of the box is a little bit scary, a little bit risky. And in our profession, we're taught not to do those things. We're taught to, kind of stay in line and toe the party line. But, when you think about getting into the field and saying, what's the one thing that everybody says when they say they want to get into the field is, I want to help people. I want to help people. And if you want to help people, this is the way that you can do that in a very broad reach, using a lot of your skills, not the exact same skills, but a lot of skills. And I think too, another fear that people have is all of a sudden, well, I'm going to be a business person now. This is going to be a business. And that can be scary too. But with Robin's support and the support of the community, there's ways to work through those mindset blocks. And if there's a huge return, not just like quantitatively, like I said, but freeing up and giving you more of your time. And it goes back to the adage, you can't pour from an empty cup. So if you're already feeling burnout, this is a way to lessen some of that while still doing all the things that are meaningful to you in this helping and healing profession.
Awesome. Well, thanks very much, Erin. I'm very happy for you. And thanks for the words that you're giving to the people who are considering doing this, and the word of encouragement that they need just from your experience of going through the process. Thanks.
Yeah, you're welcome. Thank you for everything.
No worries. No worries. My pleasure. My pleasure.